To welcome everybody to the AMAR Foundation call on the benefits of music and mental health. And with particular reference to the work that the AMAR Foundation has done in the IDP camps of Iraq and some of the research into the psychological, educational and social basis of the music offers to improve people's lives. The AMAR Foundation is joined by an illuminating lineup of music experts and practitioners today. And we'll be sharing also insights from Mariela Neagu, who's working for AMAR Foundation to look at this particular subject. And as a prelude to a wider study that will be a broadcast probably around June sometime. As you may know, the AMAR Foundation has been successfully teaching Yazidi children music in the last year and a half. And now we're looking further into this as a benefit for mental health and also for music teaching in refugee camps in general. So without more ado, I'd like to introduce the panel to you. We've got a super panel today. We have Professor Alexandra Lamont, who is the Professor of Music Psychology at the University of Keele. And she's just done some very interesting research recently on the emotional benefits. We have Tom Kiehl, who's the Deputy Chief Executive of UK Music, which is a substantial music advocacy and representation for musicians in the UK. We have Mariela Neagu, who's researching in Oxford for the AMAR Foundation. And we have, last but not least, Baroness Nicholson, who is the president of the AMAR, and will be speaking at the end. So without further more ado, if someone could possibly mute themselves, that would be very helpful. There's a bit of noise coming through. Thank you very much. Without further ado, I'd like to hand over to Professor Alexandra Lamont, who is going to be talking more about the emotional benefits that music confers. So Alexandra, over to you, and thank you very much indeed.
Thanks very much. It's an absolute pleasure to be here. I have a few slides just to organise my thoughts, and I'm not sure if they're working. Can you see a whole piece of paper here, or? I
can see your main slide.
Okay,
all looking lovely. Thank you.
Great. If nothing happens, please tell me, because I've had some problems here before. So sorry, it's an absolute pleasure to be here and to join such excellent company. I'm here to really set the scene for today's discussion. My work as a music psychologist has led me to all sorts of different areas of research and different topics. But I suppose the fundamental question that interests me, and I think it interests everybody in the room today, is what music does for people and how can this work? How can we harness the power of music to help people, to make a difference, to make us feel better, to get us through difficult times and all of those kinds of things. Do you have a second slide?
I think you have to click on it, Alexandra.
I have, but you can't see it. So that's.
We're on the first one. Yeah, it's still stuck on the first one.
Fantastic. That's the problem I've had before. Okay. Are we still stuck on the first one? Yeah.
Yes, we are. But maybe you could just read us and talk to us about what you've got on there.
Absolutely not. I'm going to reshare and see if that will sort the problem. How are we doing?
Still sitting there. It's looking like it might need to be clicked on.
Okay.
I think you need to stop sharing and then share again.
Okay.
Sadly, Zoom, yeah.
All right, let's have another go. I had this problem the last time I gave a presentation. I can see the green thing now, so that's working, isn't it? Yes, super. Yeah. Sorry about that. So as a music psychologist, as I said, I'm interested in lots of different facets of the way we engage with music and what it does for us. And I thought, I'm not going to go into lots of detail about previous research, but for anyone who's interested, there are a lot of references here if you want to follow up. And I'm sure these, I'd be happy to share these materials afterwards. What we know about music in terms of from a psychological perspective is that it activates the reward pathway in the brain. So it works like food, like drugs, like sex. It activates all of those parts of the brain that give us impulsive kind of reward. But it also activates the motor pathway, even when we're just listening to music. And this is really interesting. It's kind of telling us how important music can be, in that it's making our motor regions in the brain active, even when we're just listening. Music mostly evokes positive emotions, but music doesn't always evoke emotion, but a lot of the time we do have an emotional response, and they're generally positive emotions that are evoked there. Our preferences for music, this is an area where I've done a lot of research. Our music preferences identify us, so they say something about who we are, and they also provide a way of connecting us to other people. So this is actually really important to understand about how people engage with music. And our preferred music has many non-musical benefits. So there are many different outcomes that just having a sense of connection through our favorite music can give. The fundamental point, which I'm sure everyone is going to talk about today, is that music has this possibly unique but certainly special capacity to transcend place and time. So we can use music to connect with people we can't see, we've never met, we can connect to our past, we don't need to be physically co-present in order to have a shared musical experience. So there's a lot that we can find out about from our favourite music, and I'm going to talk very briefly about one of the studies that I've been doing about memories of music, because I think this is something that's particularly relevant to today's discussion. So I've done research over the last 10 years now looking at people's recollections and thoughts about their favourite music, their preferred music, and more recently focusing on the memories themselves. What sorts of things are associated with favourite memory? And one of those lines of inquiry is looking at people's descriptions of their strongest and most intense musical experiences. So if you had to recall something in your life, where do you go to? Where do you go back to? And what does that mean? How does that work? And we get a number of different things emerging here. There are physical responses, perceptual ones, psychological ones. We remember favourite tunes. We talk about the musical instruments. We have the emotions, which come through very strongly. We also have things that have personal significance to us, social connections, and that kind of transcendental element of taking music has the ability to take us out of our current time and place and connect us in with other things. What we've been doing more recently is looking at the Desert Island Discs, the Radio 4 programme. First of all, looking at the celebrity discourses around people's favourite music. So we've been analysing what's going on when people talk about their 8 favourite pieces of music. But through lockdown, we've revised this into basically a DIY version that anyone can do at home. And we're asking people to choose to listen to and to tell us about their 8 favourite pieces of music. And what's been really interesting is to see the similarities between these different ways of gathering the data, but getting people to talk about their favourite music. So just quickly, we have 5 key themes that are connected to our favourite music. The first one, absolutely the first one, is a sense of identity, and that's absolutely key when we're thinking about displaced people and different kinds of cultural connections. So people talk about their favourite music in relation to who they are at all sorts of levels, as a woman, as a Jamaican, as a religious person. All kinds of different things come out in these stories about music. So music, it tells us about who we are. It also connects us in with love. So people talk about their family, their partners and their friends when they're reminiscing about their favourite music. Connected to this, but separate, is the idea of support. So people are using music as a way to support them through difficult moments and to connect perhaps with people who are no longer present, to provide that kind of support through music. So it's a really important theme. What we found in relation to our DIY participants is, in addition, is a little bit about repetition, which isn't particularly relevant for today, but is interesting nonetheless, that we need to repeat our experiences in order for them to be memorable. But the final thing that I think is really important here is also we get this deep emotion and the transcendental element that seems to be going across these kinds of data. People talk about being obsessed with their favourite music, but they're also using it in that sort of spiritual way. So I wanted to end my section with a very short quote from one of our participants that sums up some of these ideas. So this is someone talking about one of their favourite pieces. They say this intimate connection that one can make with music, that it can be a safe place to feel whatever you have to feel, to express whatever has to be expressed, and that it doesn't necessarily have to make any sense. It is in that way a song, he's talking about a particular song here, to express gratitude and hope. If push comes to shove, I'd call it the single most important piece of music in my life, and it can still make me cry in the right circumstances. So you might be wondering what kind of music creates these kinds of emotions and that kind of richness. You've probably got something other than David Bowie in mind, but in this case, this is a 42-year-old who grew up in both Chile and the UK, so has had that sense of displacement. He's talking about David Bowie's sound and vision. So the song actually doesn't matter. The music is not the most important thing. It's the potential that the music has to work. And for this person, this is the music that does it for him. So just to sort of wind this up, the thoughts that I had about this particular topic today, music engages us on many, many different emotional levels. And some of these are more intuitive, and some of them we learn through experience of growing up in cultures and engaging with music. The key themes I talked about, identity, love and support, which we found in all of the interviews, we also see in other things about making music. And there's a particular emphasis on how we can bond with other people through music making in some of the other literature. And the research on migration and diaspora shows that music can play a really important role in identity. So keeping people connected with their old cultures and also forming new connections. So these themes of identity and support are seen all the way through lots of different pieces of work. So I'm going to call this to an end now and hand over to the next part of the discussion. Thank you.
Alexandra, thank you. That was so rich, and for me as a musician, you absolutely hit all my buttons many times over, so thank you. I'm particularly interested in that idea of music being something that fractured people can bring them together and hang them together, as it were, through all those different elements that it offers. And thank you very much indeed. Now I'd like to move to Tom Kiehl from UK Music. Tom, I think you'll be talking from a slightly different perspective here. But I'm really interested to hear why it's important to such a big organisation as yours. Thank you.
Thank you, Ashley, and thank you for inviting me to speak today. For those who don't know, UK Music is an umbrella body. We represent all the various strands of the music industry in the United Kingdom. So that's the recorded sector, so record companies, music publishers, musicians, creator organisations, publishers, the live sector, the whole tranche. And we're actually quite a globally unique organisation in that we represent such a broad breadth of perspectives. What it does mean, though, we were set up largely to get greater progress on policy goals, whether it's copyright change, whether it's things to do with live music provision. Those sort of issues were the ones that kind of unite the organisation. But because we represent such a broad canvas of opinion, we can only really get progress and achieve change when the whole of the sector is united. And I think it's really important today to talk a bit more about health and well-being benefits of music and why that's important to the sector as a whole too. We spend a lot of time talking about the economic value. The economic value of the music industry in the UK is worth 5.8 billion. We employ around 200,000 people. We export almost 3 billion. But there's far more to the music industry than just that and music, and it has a very powerful restorative well-being impact too, and that's something which we really are increasingly wanting to focus on at UK Music and talk more about the social value or the mental health and well-being value. And I think as the course of the year takes place, and particularly as we attempt to recover from the pandemic, and the pandemic has obviously been very devastating for many people who work within the music industry, but also it's actually been a great comfort to people, and it has had restorative benefits of music have helped people in all walks of life. Really difficult last year, it has helped them immensely. I would like to talk a little bit about Nordoff Robbins. Nordoff Robbins is a charity and organisation which is dedicated to music therapy, and they have very profound outcomes in relation to their work. Over the last couple of years, they've had 45,000 sessions of music therapy have undertaken. That's about a 17% year-on-year increase. So demand for music therapy and music therapy solutions are increasing. The positive impact of music therapy is, for me, further underlined by a study published in 2017 in the American Journal of Hospice and Palliative Medicine, which revealed that 96% of patients in a controlled study had positive responses to music therapy. Vocal and emotional interventions were two of the most effective means of improving symptoms, which included pain, anxiety, depression, shortness of breath, and mood. This study shows how important it is that music therapy is to palliative care. In the UK, we have a system called the All-Party Parliamentary Groups, and these groups work together with members of Parliament and produce reports on specific areas. The All-Party Parliamentary Group on Arts, Health and Wellbeing said that music therapy reduced agitation and the need for medication in 67% of people with dementia. The same report pointed to evidence that listening to music after a stroke hastens recovery and lifts mood. It also cited a literature review which provided evidence that music therapy may help children with autism, spectrum disorder, improve social interaction, verbal communication, initiating behaviour, and social emotional reciprocity. The charity Playlist for Life indicates that their work of creating personal playlists for people with dementia has led to 60% of reduction in the need for psychotropic medication at one care home. So these are very profound outcomes, and we're very keen at UK Music that this is firmly put on the government's agenda, and greater emphasis is placed on it. In the UK, we have a mental health charity called Mind. They have advocated research that show that the levels of dopamine work by 9% when participants, volunteers, listen to music. I also actually recommend everybody watching today to go onto YouTube or a service like that to look at a video of a dementia sufferer called Paul Harvey. He's improvised some piano performance, and this shows the very positive benefits of music can have on people's mental health and well-being. It's so striking that 4 notes on a piano did more for this particular dementia sufferer than hundreds of millions of pounds can be put into biopharmaceutical research. Music generally improves people's lives, and it's increasingly clear that the government gets this too in the UK. In a speech last year, Health Secretary Matt Hancock said, "There is increasing evidence suggesting music can bring calm to people with dementia by reducing agitation and supporting those affected to cope better with the symptoms. This is the kind of personalised care that I fully endorse as part of the NHS long-term plan." The government is supporting initiatives like the National Academy for Social Prescribing to enable GPs and other healthcare professionals to refer people to a range of local non-clinical services. This further demonstrates how the arts can contribute to rehabilitative care. This is because music experiences can be supported through social prescribing. Patients with long-term conditions who have been treated this way feel able to report they're feeling less isolated, attend 47% fewer hospital appointments and 38% fewer visits at accident emergency. Only 60% of clinical commissioning groups in the UK or patients suffering from anxiety and mental health problems use social prescribing, however. So we really want to increase this as a means for offering people rehabilitative and restorative care. Over the last 3 years in the UK, the Arts Council England have invested more than 23 million in organisations working towards health and wellbeing outcomes. Based on arts participation rates in England, the government estimates that a total around NHS cost savings due to reduced visits to GP is in excess of 160 million. So there's a very cost benefit here with music and mental health. So I think as we strive to come out of the pandemic, and it has taken its toll on all of us, and the fact that we're having to exist in this very strange and uncertain world, music has played a key role in facilitating health and wellbeing outcomes. We feel that the opportunity now to maximise that will come in the coming year and years ahead. We want to make sure that this decade is a great success for music and the music industry. And I think putting music at the heart of public health initiatives is a key sign as to where you can make that progress the most benefit.
Tom, that's absolutely fantastic. And there's, of course, the wonderful benefit of expanding the arts sector whilst reducing the burden on the health service. It's a lovely equation, isn't it?
Yeah.
Thank you for that. And it's so good to hear that the government is even behind this. Obviously a little slower than some other people like you, but you know, this is a big train that's starting to develop here. So thank you very much for that. Mariela, Dr. Mariela, you've been doing some research overall, haven't you, for AMAR, for a bigger paper that's coming later this year. and in particular the effect on refugees, etc. But what would you like to share with us at this sort of first stage? Where have you got to?
So first, to introduce myself, my expertise is really in human rights and adversity. I have researched for a good number of years now children who grew up and young people who grew up in quite adverse situations. And I've been asked by the AMAR Foundation to conduct a research for the work they undertake in Iraq, particularly with IDPs, with internally displaced people, and particularly the Yazidi ethnic minority and the Yazidi people. So I've been looking at research about the impact and the benefit of music in human life, really. And some of the things have been said, but I'd like to mention a few studies which were systematic reviews which researchers have undertaken, looking at several studies particularly in health, to see what was the impact of music. And one of them, which was published in 2013, looked at nearly 100 research studies, many of which reported outcomes. And in addition to what has been said, it's also the building of interpersonal relationships which music have, as well as self-expression and personal resources. Many studies have found indeed that music reduced anxiety and depression. And a study published this month by Dr. Dagan and Ali and King has looked at the impact of Sufi music, which I thought was interesting because it is in a way spiritual music. And that study found significant effects for depression, schizophrenia, as well as stress. And it has also found that patients who listen to that type of music, although because this is what they explored, but probably it applies to other types of music, to other kinds of music as well. So patients undergoing angiography, colonoscopy, bone marrow aspiration, and biopsy procedures have had a reduced level of stress if I listened to music during those medical procedures, which can be obviously quite stressful. Now, again, it has been mentioned, but music really is part of the individual as well as social and national identity. And that is particularly important for the Yazidi people and for the initiative which the AMAR Foundation had in starting this program with really multiple benefits. So music is part of who we are as individuals, as well as who we are as part of a group, and gives people that sense of belonging. A recent study published by a couple of researchers, one in UK and one in Finland, Katarina Schaffer and Thomas Irola, explored music as social surrogacy. They had this social surrogacy hypothesis. So they undertook an experiment in which they wanted to see what do people do when they're alone. So they either watch television or read a book or listen to music. So they wanted to compare those experiences. And what they have found was that, indeed it was a kind of social surrogate for all three activities. However, what was special about music was that it was only music that elicited nostalgia, that kind of appealed to and evoked past memories of people, whereas the other kinds of activities didn't. So music is very much part of who we are. And as part of the study I'm conducting for the AMAR Foundation, I have interviewed a number of young women who are part of the Yazidi choir set up by AMAR, and who spoke about what music meant to them. So these were children at the time. They went into the camp, and they were they are in their early 20s now. One of them has told me that as a human, I cannot live without oxygen. I can't live without music either. Another one said that music is a great gift. I psychologically get better when I play music. It's my life dream to take the message of the Yazidi people internationally to other countries, to take the Yazidi music. And another quote from one of them, music means everything for my life, and music is the only friend that I could ever have, because whenever I feel sad or depressed, I listen to music to overcome my traumas by music, because for me, this is the best therapy. I can't trust everyone to speak with about my tragedy life, about my story, and no one will understand the sadness in my life except music. So these are particularly powerful. As you probably know, these women have been really at the end of spectrum in terms of violence and trauma which they suffered when they were taken to sexual exploitation and slavery by the ISIS. And, you know, it is something in a way as simple as music that can address the trauma and replace services which basically don't exist. I would like to end on a more positive note with a couple of quotes which I have found again during my research. One of them is from a professor in Australia who has undertaken research with indigenous, with Aboriginal people, and looked into their culture and the role of music. And in one of her lectures, she said that no human culture has ever lived without music, and arguably music is older than language or agriculture. And perhaps, you know, this is not something new, but it's quite useful to every now and again to think about music from that perspective in terms of how fundamental it is to human development and to human beings. And another quote comes from a spiritual leader from Greenland, from the Inuit people, who said that songs are thought, sung out with the breath when people are moved by great virtue, and words no longer suffice. Thank you so much. So I think a lot has been said today, so it's not so much more I can add in terms of research, just that there is plenty of evidence, and I can only commend the initiative of AMAR of, you know, coming up with such an important and in a way perhaps such a simple idea, but great ideas are often, you know, quite simple ideas.
Thank you very much, Mariela. One line came out there really interestingly: replace services that don't exist. That's really significant, actually, because that you know, it's music's, as you know, something that is intangible, that you can travel everywhere, but where you can't get doctor's services or whatever to anywhere, music can reach the parts that other medics can't get to. So that's an interesting thought to hang on to, I think. Mm-hmm. With that thought, I'd like to introduce Baroness Nicholson of Winterbourne, whose original idea it was to bring music into the camps. And Emma, I'd like to hear from you now, please, about your vision for why you wanted to do it and what you'd like to say. Thank you.
Thank you very much, Ashley. It's a great honour to follow three such distinguished speakers. I'm a member of Parliament, a member of the House of Lords at the moment, but basically a politician. And my keen interest is in recovery from trauma, recovery from desperate situations, or just recovery from a very poor situation into which you happen to have been born. I want people to be alive and kicking and self-supporting and competitive and enjoying life. I was born and brought up in the aura of camps. As a child, Auschwitz emerged, and that, of course, was a death camp. And we moved from there to the Urgers, which almost appears to be another death camp. But there is another sort of camp where the residents are not designed to die, not designed to be further killed, but where, in a sense, the modern world just leaves them aside so that they are forgotten people, totally and completely by all of us. And I think the Yazidis fall almost completely into that pattern. Why are refugees there at all? And what is the difference between a refugee and IDP? Well, the Geneva Convention in 1951 was the convention that was set up to embrace the victims of the First World War and to help them get back home again. The purpose was to give them a time of food, clothing, and water, and basic hygiene. So those four things that form the basis of the Geneva Convention that the UN is meant to provide for all refugees everywhere: food, water, shelter, and I think it's food, water, shelter, and hygiene. Ladies and gentlemen, colleagues and friends, that is 1951. That convention is still the one that is used, and we are now in 2021. And the situation has changed dramatically, drastically, and I would say for the worse. Initially, this was for refugees, Russians, others who had been forced away from home because of the First World War. Now it's not just refugees, it's also what are called IDPs, internally displaced people. The Geneva Convention covered refugees. So, ladies and gentlemen, IDPs are not covered by the Geneva Convention. Your question, therefore, is, well, first of all, do they matter? Are there many of them? What does it mean? And the second question must be, well, what are they covered by? And the first question, what are IDPs? They are people who've been driven out of their homes by their own government or people or societies. That means they haven't crossed an international border. So they are not under the Geneva Convention. So what are they under? They're under nothing at all. There is no UN convention that covers IDPs. Well, does it matter? Maybe there's just a few of them. Not at all. There are many, many millions. They vastly outnumber the actual refugees. But it's terribly hard if you visit a camp, and I visit many, to distinguish between them. These are all humans who've been driven out of home, very often for religious persecution, sometimes for other persecutions, sometimes just because their neighbor or the neighboring bunch of people want their businesses, their profit, their farms, and everything else. So these are people without a home. And worse than that, when they're actively persecuted, they would have been tortured, they would have seen people being killed. In the case of the Yazidis, they've seen people being live crucified. We're going through this week, going to Good Friday, for example. Burnt alive, and if you can think of anything worse, I can tell you it has happened to the Yazidis. I can tell you horrible, horrible detail. So the IDPs are a vast block of humanity in many, many millions. Maybe 50, 60, nobody's quite sure how many millions there are. And there are also the refugees, and there is two different ways of dealing with them. So my concern is that these people are not a forgotten misery, not disappeared, not gone, not out of sight, out of mind, but that they are people who've just managed to survive, yet with all of these traumas in them. And worse than that, they've lost family, they've lost friends, they've lost their house, And remember that even refugee camps, let alone IDP camps, do not provide any safety at all. So you'll find stolen children, you will find all sorts of awfulnesses happen in camps because nobody is in charge of protection. Therefore, every single person in these long stay camps, and it's long stay camps I'm talking about, they are hugely vulnerable to physical, mental, and other assault and depredation. The camps, therefore, are the most miserable place that one can ever think of. And because the 1951 Geneva Convention, even if it only covers a proportion of the people, all it can offer, because of its initiation, is hygiene, food, clothing, and a little bit of shelter. By a little bit, I mean a little piece of plastic covering. Of course, what does that leave out? It leaves out everything that makes life worthwhile other than survival. It leaves out music, it leaves out religion, it leaves out poetry, movement. It leaves all the things that really matter to make us a human being. It discards all of that. Why does it discard all of that? Because despite many efforts, including my own, minuscule though that may have been, to get UNESCO, United Nations cultural organization, science and culture and education, keyword education in there, UNESCO is not in the camps. Try again to get them in. It's not for want of trying from UNESCO. It's just that the member states of the UN don't think highly enough of IDPs and refugees, although there are probably 150 million of them at least. They don't think highly enough of them to be bothered to pay the tiny little extra gift, tiny little extra budgetary gift that they could do that would provide UNESCO in these camps. So you don't have anything that really makes life worthwhile. And of course that cuts out all hope because there's no future. I trained as a musician at the Royal Academy, LRA, MRCM. I knew Nora Robbins. I was on the very first music therapy charity as a member of the board. And I'm vice president of one of the APPG's all-party parliamentary groups that Tom mentioned. In my case, I'm vice president of the one which deals with music education. I feel very powerfully indeed that music is the key. I think we know more or less that music is 1 million years older than speech, and that it provides so much that a human wants. If you think about music, all religions are sung. It gives poetry capacity, it gives movement, it gives tribal links, it gives singing, it gives collective movement and music. And of course, it brings music and mathematics and logic and thinking. So it brings in proper education as well. So visiting these desolate places and the most ghastly areas in the globe, it's absolutely obvious to me that particularly with IT, which was my second training in computers, particularly with electronics, these places are far away. It's hard to get to them. Nobody has the money, nobody has the capacity, nobody has even the visas these days. But we can do it another way today. We're very, very blessed in having IT and in having musicians. So we want to bring the two together. So I offer you the thought that music can save the lives and futures of refugees and IDPs, who are among the highest level of suicides in the globe, and who can be surprised by that.
Thank you, Emma. Very profound thoughts there. If I could share some questions that are slightly aimed at Professor Alexandra, if that's okay, because people are quite interested in the connection that music makes. So Alexandra, if you don't mind, can I field 1 or 2 questions at you, if that's all right?
Sure.
From the audience. Mr. Abdurrahman Isaac says, thank you for inspiring words. Could you let us know how music can connect people, in this case refugee people, with their identity and past experience? How exactly does it contribute to the remedy of war? How can that work, do you think, in what mechanism?
Yeah, this isn't my area of specialism, so I don't want to take up all the questions with things. I'd be very happy to talk to people later, but I think in terms of sort of psychological mechanisms, I mean, the bonding thing is extremely important, and the memories to me seem to be the other thing that are absolutely critical. So there is a lot of very distinguished research on music and diaspora and music and migration, which I haven't been involved in personally, but which I'm aware of, that shows that actually it sort of eases a transition, if you like. So when somebody has elements from their past culture, and music is something that you can carry in your head. You don't need an instrument, you don't need equipment, you don't need to pick anything up. You have all of your favorite music. You can either listen to it, replay it, sing it, share it, and so on. Then this is a way of holding on to and celebrating existing cultures. But what music can also do, which I think could be of great interest here, is bring people together and make them look forwards as well. So people sharing their different musical cultures in camp scenarios could be a way of learning about other cultures and learning stories and narratives from different parts of the world. So I think it's really those two things, the bonding through music, which is something, music is in ordinary circumstances when people are not dealing with all of this disadvantage, it's one of the first things people will talk about with a stranger to get to know them. What kind of music do you like? Do you play music? You know, these are things that tell us about people. And so we can transfer some of that into these other more extreme situations. It could be a way of opening up a conversation, but also celebrating where people have come from, and that national identity that Mariela talked about, I think, is absolutely key there.
There's just another slight angle to this. Someone says, is it possible to deselect the bad? Can the good music override bad experiences? Is it that powerful, or does it just allow you to move on?
I think music works as consolation for a lot of people in a lot of different circumstances. So in our study with lockdown, we were asking people to play their favourite music, and we had a lot of stories about how people were reminded of happier times, of people who were no longer present, lost loved ones, and those kinds of things are coming through in this. So I think it's a consolation activity, but that's not going to necessarily heal somebody all on their own. They're going to need some support, and they're going to need some resource. And I think whilst music can be extremely powerful, it isn't going to take people out of camps. It's going to make their experiences more bearable. It's going to make the situation feel more positive, and I think that's absolutely essential. But it's not going to cure the problem. It's going to help with the sort of fortitude to deal with what's coming.
I'm getting the sense overall that music is music is a pretty powerful panacea for a lot of things. Can get to the parts that other services can't get to. It affects people in different ways. It builds people back up again. Tom, I mean, what do you think needs to be done to just make this an absolute priority everywhere? I mean, you know, the equation between arts and health, for example, is a very powerful one. For the individuals, it's powerful. This is such an obvious solution, someone's saying here. How come it's not really been more prevalent up to now? And what can we all do to make this an absolute fundamental steamroller of an argument?
I mean, my experience is largely based on UK government and stuff, so I can't really speak sort of internationally, but I think one of the challenges we've faced is that quite often policymakers, decision makers, particularly directly within government, feel that music is a nice to have, but don't necessarily really fundamentally understand the profound benefits and how to then best support it once they've kind of achieved that and understanding. So I mean, we have seen progress definitely in the United Kingdom over the last 5 or 6 years in terms of a greater appreciation of music's value, both on a kind of economic and a social and the music education side of things. But it's just not really getting to translating it to that next stage, I think. I mean, Baroness Nicholson is a great example of a policymaker and who totally gets this and totally understands why it's important. We just wish there was far more of them who would take that view as well.
Okay. Emma, did you want to say something? If you unmute Emma. Hello, Emma.
Me? Oh, excellent. Thank you very much indeed. 2 points, please, one from each of my fellow panelists. The first is to Tom. Tom, I think we started to make a bit of progress on getting music back into schools in Britain, when you manage to get some musicians into the House of Lords. There's about five of us, 4 or 5 of us there now. And if one person isn't brought into government, another one is, composers and performers. And I actually think, therefore, and this links in immediately to the point that the professor made, I actually think it's terribly important to get people up at the top of any society to prod those who have the authority. And that fits my point very well indeed about the lack of UNESCO in the camps. Most people, and there's at least one person on this session who understands completely, who is a nurse consultant, most people don't know how difficult it is to get to camps, how impossible it is even to know that the camps exist. It is really hard because these camps are scattered all over the globe in the worst possible places. I've got a camp picture just behind me by coincidence, actually. This is where the Yazidis are. And the picture doesn't quite show how barren the land is, how cold it gets, -35, how hot it gets, +35 degrees, and how incredibly difficult it is, in fact, impossible to grow anything on it. Well, why is a camp there? Because there's nowhere else to put a camp of 45,000 to 175,000 people. So camps go in places where humans are not working and not living and not producing. And that means it's really hard to get into them. Mostly also, governments don't want you to see camps. They're only too happy if somebody visits to go and help you see the president, for example. The last thing they want you to see is the filthy dustbin at the back door, which is what they will consider the camps. So it's not at all easy to get into camps. It's really quite difficult. And to be allowed to work in them as well, you have to be a registered this, that, or the other, and you have to have some money. And once something goes out of the headlines, as we all know, it's devilishly difficult to find any funding to help at all. So I think getting people at the top is crucial. And how to do it? Well, my focus, my idea, is that, as I told you, some form of health comes within the obligation of the UN. In fact, they use that health for the 1951 Geneva Convention for physical health. What I mean is human waste disposal and stuff like that. But there's no reason why that shouldn't cover mental health. So my aim is to get to the Secretary General of the UN and to suggest that he should take a look at mental health within that context. That doesn't demand that he changes any rules at all, but it does mean that we have to have something ready to give him, to show him. And there's where I would take a little bit of issue with the professor. If you have somebody who's had all the things that we know refugees have gone through and IDPs and have lost everything, music together, or mainly together, but also alone, gives huge amount of confidence. It gives capabilities, it gives skills, it links you into a much different world. And I think that with that, you can turn away from suicide and you can start to look outwards and you can begin to be trained for a job and education. So actually, I think that music can definitely take you out of camps.
Yes, thank you, Emma. There's just one question. Sorry, Mariela, do you want to say something?
Very brief comment, just to say that at one of the interviews in January, the young woman I was interviewing has told me that 5 or 6 young women had committed suicide. So I asked if she knew any of them, if any of them were members of the choir, and none of them were. So that suggests that, you know, whatever happens in the camp, at least it will maintain their mental health and their hope to a minimum level.
Thank you. There's a question. Hello, Alexandra.
Yeah, just to come back very quickly, I would absolutely agree with those points. I was just making the point that music isn't going to solve the problem of camps at a wider kind of political level. You know, there's often music is the way you were going, Ashley, is kind of to suggest music will solve all our problems. It won't cure cancer. it might make the process easier to deal with. It might actually help in a long-term way because people might feel better, they might support their treatment better. And I think at an individual level, definitely it will make a massive, massive difference to people's lives. Just let's not overclaim, because we've got to be careful about, you know, it's not going to solve the problem of camps. It's going to solve people's individual journeys and groups of people's journeys through them.
Yes, I get a bit carried away sometimes. Thank you. For last question here really is from actually General Lopez here. He says, how can we get the UN on board on the importance of this for the culture for refugees and refugee camps? How can we do that, Emma, or anybody, or Tom? Hello? I don't think Emma can hear me. Tom, would you like to say something?
Tom or me?
Yes.
Sorry, repeat it again. Sorry, I missed it.
How can we get the UN on board? I think Emma's alluded to getting senior people on board to prompt it, but how can we best get the UN on board on the importance of music and culture to refugees? What's the best way to do that?
I mean, Emma and Lady Nicholson will have more direct experience, I think, on a kind of international basis of this, but instinctively, I think you need to get a coalition of support across a number of member states, and I think trying to identify who those kind of key individuals who are most likely to take up the cause. And I think that was something that where I feel that if you need to get it accelerated to the UN and get to the highest level there, that would be the and we can take it forward to some extent within the UK and help from that perspective. But I think we have sister bodies and organisations similar to us that we work with in other countries. So if we can get it more on their radar, and then they can put that lobbying in, and reciprocally we can maybe potentially make progress, at least from an industry perspective.
Thank you. Just any closing comments anybody would like to make? Would anyone like to add anything at this stage before I say goodbye to everybody and thank them? Okay, I think we probably said everything we want to say. I'd like to thank everybody for listening in. I would remind people that AMAR is a charity, and we do also rely on donations as well. So feel free to open the wallets at some stage, and you can do that via the website if you like. I'm going to try and share a little bit of the Yazidi Girls Choir with you. It may not work, but I'll try this if I can share. No, I'm not sure I can share it. No, I'm sorry, I'm not sure I can share it. Anyway, I was going to show you the Yazidi Girls Choir, which again you can see on our YouTube channel, and you can see some of the girls singing there. So first of all, thank you very much to Professor Alexandra Lamont. Fantastic insight into the emotional basis of music, the benefits of it, and what it does for people. Thank you so much, Tom, for your view on the government angle on this and why music's important to larger groups of people. Mariela, thank you for your insights, particularly for individual ones on the camps and the girls. And Emma, thank you very much for your big picture view of why you're doing this and what is behind this very important element. And if we can knit together the power of music to solve, or at least some of the issues in the refugee camps, and I think a lot of people will feel a lot better off as a consequence of that. So can I thank you all very much indeed. We'll be having another one next month. I think we might be having Michael Spitzer, who's got a new book out called The Musical Human, which is hitting the charts. So you might want to read that, and hopefully we'll find a date for that in a month's time. And then we'll have another session after that with Michael Bockman, Emma again, and maybe some other people too. So thank you all very much indeed, and thanks for coming. Bye-bye.
Thank you. Bye.
Thank you, Ashley, hugely.
Thank you.